Mine were pretty simple compared to the rest of the group, so I just did that.
First name.
Yeah.
Anyway, name 3 reasons why to administer IV therapy. This is volume 2, chapter 4, page 235.
Thanks.
Fluid and blood replacement, medication administration, and obtaining dangerous blood specimens for lab analysis. 63, name 3 reasons for metabolic acidosis. Volume 2, chapter 1, page 29 and 30. Biggest ones, cardiac arrest, DKA, and renal failure. 64, what is multi-organ failure? Volume 2, chapter 1, page 85. It is the progressive impairment of 2 or more organ systems resulting from uncontrolled inflammatory response due to severe illness or injury. My terms, you get hit in the gut, rupture, like a liver or something like that, and then that has a multiple, like a cascading effect on you slowly dying.
That's not exactly what we're talking about here, though. You're on the right track, but not exactly.
Okay.
So it has to go through the process of compensated versus decompensated versus irreversible. Following irreversible is when you start getting into the organ systems that are affected by that.
Gotcha.
So this is like to your example. This isn't like when the liver take a shot and they end up in this. There's a process in terms of going through that. Make sense?
Yep.
And so it kind of goes past that irreversible shock that's on the borderline of death.
Cool, thank you. We are at 65. Subcutaneous injection is given at one end of the skin, 45-degree angle going to page 249. 66. What are the components of Bextriad and what does it mean? JVD, multiple heart tones, and hypotension. They are signs of chest trauma and possible pericardial tamponade. Volume 5, chapter 8, page 202, and then also a little bit farther back, 208. 67, what is the maximum amount of fluid you can administer per nair for the mucosal device? I couldn't find this in a book, but I had it written down from a lecture somewhere. It's 1 milliliter per nair. Name the drugs that you can administer through a MAD device: Narcan, fentanyl, Versed, and Ativan. Pharmacology book, chapter 3, page 57, and also Chris Nelson, because I couldn't remember Ativan. 69, complications of IV process. There is a whole list of them: pain, local infection, fever, allergic reaction, possible air embolus. Volume 2, page 267, 268. Name 3 reasons for metabolic alkalosis. Diuretics, large amounts of antacids, prolonged vomiting. Volume 2, chapter 1, page 30 and 31. Which electrolyte is most affected if someone is hyperkalemic? That is potassium. Volume 2, page 40 and 41. What is tidal volume? I pulled this one from Dr. D's Vimeo lecture. The normal amount of air you take in during inspiration. What is facilitated diffusion? Number 73. Water-soluble molecules and ionized molecules that can't move across the membrane by themselves, so they need the help from a carrier protein to move across. Volume 2, chapter 1, page 34.
All right, number 74. Name three reasons for a patient in respiratory acidosis and what is the priority in treating them. The 3 are hypoventilation from narcotics or drugs, cardiac arrest, or a COPD patient. The priority is to treat their airway and breathing. 75. What is the difference between osmosis and diffusion? Osmosis primarily refers to water and is thought of moving from an area of low concentration to high concentration. Diffusion refers to the shift of gases that move from an area of high concentration to low concentration. 76. How much medication can you administer through the deltoid muscle? 2 milliliters per deltoid. 77. What are the 3 stages and characteristics of shock? Compensated. Body is able to maintain homeostasis and is characterized by increased heart rate, increased blood pressure, agitation, and the skin will be pale, cool, and diaphoretic. Decompensated shock. Control over bodily functions begins to diminish and is characterized by hypotension, heart rate beginning to decrease, and the patient is responsive but altered. And the last, irreversible stage, multi-system organ failure, death is imminent, bradycardia, arrhythmias, severe hypertension, kind of variety. Number 78 was crossed off because it's pretty much the same question as 76. 79, when do you want to use a short, large IV needle over a longer, large IV needle, and why? The benefit of using a short, large IV needle or catheter is to produce rapid infusion of fluids. This is in reference to I don't know how to pronounce that. Pascal's law. 80. Of the total blood volume, what makes up plasma, red blood cells, and formed elements? Plasma is made up of 92% water, 6 to 7% proteins, and small portion consisting of electrolytes, lipids, enzymes, clotting factors, glucose, and other dissolved substances. 81. Name 2 types of isotonic IV solutions used in the pre-hospital setting: normal saline and lactated ringers. 82. Name 3 places for an IM injection where greater than 2 milliliters is needed: dorsal gluteal or the buttock, 5 milliliters; vastus lateralis or the lateral side of the thigh, 5 as well; and the rectus femoris, which is the anterior side of the thigh, 5 again. And number 83, what is a multiplex form of radio communication? I put down duplex systems with additional capability of transmitting voice and data simultaneously. Is that what you're looking for, Gary?
Yes, sir.
Okay.
Alright, I got 84.
Hey, hang on just a few seconds. Chris, let me take you back to number 80.
Sure.
Of the total blood volume, what makes up plasma, RBCs, and form elements? Plasma is 54 in terms of 100%. So what the question is, 100%.
Okay.
So plasma makes up about 54. RBCs make up about 44. Form elements make up about 1%.
Gotcha.
You did. Okay, 84. Water accounts for how much of our body's weight, and that's 60% of our bodies are made up of water. Number, I think, 5. Name 4 major types of shock: obstructive, hypovolemic, cardiogenic, and distributive shock. Number 86, what is active transport? Active transport requires energy and is the movement of ions or molecules across cell membrane into a region of higher concentration, and that requires ATP. Name 3 major ions: potassium, sodium, and hydrogen. What is a colloid? A colloid is a solution of larger molecules that do not pass the semipermeable membrane. They're also known as volume expanders. Next one. What position do you want to place your patient in when starting an external jugular vein IV? I found this one. You want to place the patient in the Trendelenburg position with the head slightly elevated. Describe 3 body systems that help regulate acid-base balances. That's the renal system, respiratory system, and the buffer system. What are the normal ranges of pH and HCO3 and PCO2? pH 7.35 to 7.45, HCO3 22 to 28, PCO2 35 to 45. Name the 3 different stages of shock and describe the difference between the 3. Compensated shock is 15% blood loss. Your body is still perfusing. Decompensated shock is 15 to 30% blood loss, where your body is starting to lose adequate perfusion. And irreversible shock is 35% or greater shock, where you're no longer perfused on its own, and the body cells are unable to be resuscitated. Then I have what is trunking form of radio communication, and that's the pool of a bunch of frequencies on one channel. It allows for multiple different agencies to communicate with each other. And the last one I have is what does the acronym LEMON stand for? Look, elevate, or evaluate, Allen Party score, obstruction, and neck.
Cody, can you go back to number 90 again? Tell me what you mentioned there about the 3 body systems regulating acid base.
Oh, the renal system, respiratory system, and buffer system.
So what's the difference between the 3 of them in terms of how they act?
The buffer system is your short, fast. That's your cellular level where your bicarbonates
your HCO3 is binding with your hydrogen atoms and flushing out your respiratory system, is increased respiratory rate where you're blowing off CO2, and your renal system is your best working system. It takes the longest, and that's the filtration system, filtering out the acid or base or hydrogen atoms and bicarb.
I got a question, Greg.
Yep.
I think you said on 89, Cody, did you mean reverse trim over? I think you just said it was on external trigger.
Yeah, reverse. Yeah.
Oh, you did say reverse?
Sorry.
Okay.
So how do you want to position your paving? Let me just give you a heads up, folks. You can disregard this question for next week, but let's talk about it. Think about an EJ, okay? So you want to start a line here. What position would be helpful in terms of placing a person? Heads up or heads down? Head down. So we're through the, or excuse me, Tredellenberg in terms of feet up.
So not reverse. Great.
I said chin
You're
down.
supine or feet up, whatever that is.
Also, you want to go for
Feet up.
Oh,
Okay.
Gary, one question.
Yep, Charlie.
Question number 77 and 92 seem to be about the same question. Is there anything different in those?
Chances are it's happened twice, that's all, but let me take a look. 77 and what?
92.
Yeah, forgot first.
What'd you have for 77, Charlie, on yours? Stages of shock?
Stages of shock, and then 92
Yeah.
stages of shock.
No, nothing different there.
Okay.
Are we at 95 now?
Yeah.
Okay. So when might a nasotracheal endotracheal tube be considered? The two situations specifically listed in the book were trismus or an anticipated difficult laryngoscopy. There's a few relative contraindications such as suspected nasal or basal skull fracture, combative or uncooperative patients, and coagulopathy. I thought it might be notable that it's absolutely contraindicated in cardiac or respiratory arrest.
Why?
That was volume 2, pages 349 and 350.
Why?
It didn't specify.
Yeah, but you could specify.
Why would you not want to use it in a cardiac?
Why could you not use it in cardiac arrest? Why? So what-
Probably place it with that tool, the BAM.
Right,
If
but
they're not breathing,
even
you're not going
past
to whistle.
that, to know where your placement is, you have to be able to hear them breathing. So as that tube comes through the cord, you're gonna hear the whistling up through that tube. So you have to have somebody that's breathing, probably agonally, but you have to have somebody breathing nevertheless.
What was the reference of that?
The volume 2, pages 349 and 350.
You said anticipated what?
Anticipated difficult laryngoscopy. So if they're like, if they had like a really, really anterior abnormal airway, you're just not going to be able to get that tube with regular procedures. What does the acronym BONE stand for, and when would you use it? This was from the Larson lecture. BONE stands for bearded, obese, no teeth, elderly, and snorer. It's a list of factors that predict the difficulty in achieving an adequate seal on a face mask for ventilation. Name 2 drugs and their doses that are listed as sedative hypnotic effect used for RSI. 2 drugs that are sedative hypnotic agents that are listed as induction agents for RSI are etomidate, which is ultra short acting. That's dosed 0.1 to 0.3 milligrams per kilograms over 15 to 30 seconds. The other one was ketamine, which causes a dissociative state. That one's dosed 1 to 4.5 milligrams per kilograms, or it also lists 3 to 8 milligrams per kilograms IM.
What's the third one, Jerry? Have them out.
Percent.
Percent and how much dose?
2 to 2.5 milligrams.
That will work, yeah. 1 to 2.
1 Yeah, 1 to 2.5, right?
Your book says 1 to 2.5. We're gonna blow it out of the water in a little bit, but for right now, 1 to 2.5.
Name 4 indications for endotracheal intubation. Respiratory arrest, cardiac arrest, airway swelling due to anaphylaxis or airway burns, for example, and suspected or actual inability of the patient to maintain a patent airway. That was volume 2, page 336. Name the number 1 reason for suspecting an esophageal endotracheal tube. The number 1 reason listed in the book was the absence of chest rising breath sounds during mechanical ventilation. It also listed gurgling sounds over the epigastrum with each breath, distension of the abdomen, absence of condensation, a persistent air leak, even despite inflation of the distal cuff, phonation, absent waveform, or no change on colorimetric CO2, and that was volume 2, page 342. Question 100, what are the 3 types of intracranial hemorrhage? From our lecture notes, we actually had 4 that were listed. Epidural hematoma, that's blood between the skull and the outermost covering of the brain. It's usually related to high pressure bleeding. Subdural hematoma is when blood collects on the surface of the brain, result of the head moving forward rapidly and stopping, such as in a car accident. Third type was subarachnoid hemorrhage, which is bleeding between the brain and the thin tissues that cover the brain. Some common symptoms would be like a sudden sharp headache, loss of consciousness, and vomiting. And the fourth one was intracerebral hemorrhage, which is bleeding inside the brain. This is the most common type that occurs with a stroke. Difference between Kussmaul and Cheyne-Stokes respiration. Kussmaul breathing is a deep and labored breathing pattern that's associated with severe metabolic acidosis, particularly DKA. And Cheyne-Stokes is an irregular respiratory pattern in which the patient breathes with an increased rate, followed by a period of apnea or lack of spontaneous breathing, followed again by a pattern of increasing rate and depth of respiration. 102, define a transection of the spinal cord. Transection is a complete tear of the spinal cord. Name 3 reasons for an upper airway problem. A few of the listed reasons were the tongue, foreign bodies, trauma, laryngeal spasm and edema, and aspiration. That was on volume 2, page 308. And then, what is the difference between a depolarizing and non-depolarizing agent, induction agent, and give an example of each. Succinylcholine is the only depolarizing blocking agent that's listed in our book. That's on page 391 of our pharmacology book. It depolarizes the synaptic membrane, but it resists acetylcholinesterase, so it continues to depolarize, which results in brief periods of muscle fasciculations, which are uncoordinated muscle twitching. And then a non-depolarizing agent is a competitive agent. It blocks acetylcholine, preventing the muscle from depolarizing. A couple of examples of that would be vecuronium and rocuronium.
Number 5, what is an endotracheal ETT? It's an ETT tube with a proximal O-shaped ring attached to a plastic wire. It runs down the length of the tube, and it terminates distally, and when you pull on the ring, it kind of bends the distal end of the tube up upwards to direct into the glottal opening. And it's best used in the nasotracheal intubations. What is the primary neurotransmitter of the autonomic nervous system? Acetylcholine. Who is an open cricothyrotomy contraindicated in, and that's anyone or children under 8. Newton's second law says a body at rest will remain at rest unless acted upon by an outside force. What does this mean? Basically, at rest it needs some sort of outside force or energy to get it moving again. It's going to stay where it's at. Example would be like a car engine. You applying the gas and get that energy in the motor moving to move the car, or something slamming into a solid, an object like a car rear-ending somebody to get that force to get the acceleration or deceleration. And then number 109, Newton's first law states a body in motion will remain in motion unless acted upon by an outside force. And what does this mean? So it means the body will continue on its pathway that it's set on until an outside force, say, sports, you're playing and you're going one direction and somebody else comes and either changes your directions or stops your motion altogether, or like a car running into a tree or applying a brake to decelerate the car. And the smaller the object, the smaller the force, the easier the transition. Obviously, the larger, the faster the force is going to cause more damage. Streider is considered what kind of an airway problem? An upper airway problem. The child is burned on both sides of their legs and anterior side of their abdomen. What is the percentage of burns? 36%, if I did that right. 112, name the likely causes of respiratory alkalosis. Fever, hypothyroidism, CHF, liver failure, and ascension into higher altitudes. 113, what is the purpose of the National Registry of EMTs? It's to prepare and administer standardized tests for the various EMS provider levels, to establish the qualifications for registration and biennial registration, and serves as a vehicle for establishing a national minimum standard of competency that supports the development and evaluation of EMS education programs. And 114, name the 4 elements of informed consent. The nature of illness or injury, the nature of the recommended treatments, the risks, dangers, and benefits of those treatments, the dangers of refusing treatment and or transport. And there's also a 5th one, alternative treatment possibilities, if any, and the related risks, benefits, etc.
115, define professionalism. The conduct or qualities that optimally characterize a practitioner in the field or occupation, volume 1, page 48. 116, define reflection. To check your understanding and ensure the speaker echo his message back to him using your own words, volume 3, page 41. Give examples of administrative stressors, waiting for calls, shift work, loud pagers, and inadequate pay, volume 1, page 70. Name 3 considerations of performing a cricothyrotomy. Indications that may warrant cricothyrotomy include situations that prevent adequate bag valve mask ventilation, extraglottic airway placement, and ET tube placement by oral or nasal routes, volume 2, page 359. 119, what is the interpersonal justifiability test? Whether or not you can defend or justify your action to others. It's volume 1, page 141. 120, what is the impartiality test? Whether you would be willing to undergo this procedure or action if you were in the patient's place. Volume 1, page 141. What is the universability test? Whether you would want this action performed in a relatively similar circumstances, which helps the paramedic to avoid short-sightedness. Volume 1, page 141. 122 is the same as 119. 123, you have a trauma patient with eye opening to verbal command, verbal response with inappropriate words, and a motor response to decortorate posturing. What's the patient's DCS? It is 9.